All right, thank you very much, Michelle. Appreciate the introduction. A couple of little webinar issues before we really get going. It looks as though we're on track to be able to have time for questions. So if you want to ask a question, type it in the Q&A button, which is right here on my screen. About the chat button, which for me is right over there. If you want everybody to see it, make sure you're addressing it to all panelists and attendees. We have a great, robust chat going on, and that was kind of an unanticipated benefit of doing this in the virtual format. So we're really pleased with how that's going. Let's keep it up. And I also see 392 people in attendance today, which is just way more than we could have accommodated doing this in person. So there are upsides to it too. Well, my name is Joe Hannell. I am the communications director at CHI, and this is my 6th time doing the legislative preview with my colleague, Allie Morgan, who will be hearing from us later today. But obviously, we've never had anything like this. There are upsides, but we do miss the interaction with the crowd. In rehearsing this and practicing, I understand why the National Football League pipes in crowd noise. And I wanted to kind of give that a shot today because I miss people chuckling politely at my dumb jokes. So how's that? Well, yeah, maybe that's a bit too much. Maybe I should just get down to business. So our big ideas today. First, True Blue. Colorado's election results show you can't really call this a purple state anymore. Democrats did better here than just about any so-called swing state in last month's election. Right after this presentation, Christy Ariano will be moderating a panel with 3 excellent journalists about the campaign in Colorado and around the country, and they'll go deeper into this. Next, in the red, Democrats have all the power here in Colorado, but not the money that they need to carry out their biggest plans because of this, at least in part because of this COVID-induced recession. And finally, purple policy. See the theme there? There are a lot of health policy ideas converging on the legislature. Allie's going to walk us through the big ones in the second half of this presentation. So obviously the big headline of the election is that Joe Biden will be sworn in as president in just a little over a month. It brings an end to Donald Trump's administration after 4 years. Here in Colorado, Biden beat Trump by over 400,000 votes. That's Exhibit A, and why we're calling Colorado True Blue. Exhibit B, former Governor John Hickenlooper, Democrat, beat first-term Republican Senator Cory Gardner. And this race was never really close, although Gardner did get more votes in Colorado than Trump. Still, other Republican senators in close races, like Susan Collins of Maine, for example, they survived the election. Colorado broke harder for Democrats than most other states did. The voters spoke, and they spoke loudly. Nearly 87% of registered voters cast a ballot. That's a state record, and it adds up to almost 3.3 million people. And that's during a pandemic and many other disruptions this year. So give yourself one of those selfie pats on the back that we have to do these days since we're not sitting next to each other. Here's how Biden and Trump did in Colorado. It's a pretty familiar pattern, with Biden winning the metro area and this kind of C shape of mountain resort counties. What I'd like you to pay attention to here, though, is these lighter colored counties. That's where the vote was closest, and that's where we see the most potential for changes in future elections. So look at Pueblo, the light blue splotch in the bottom center. Pueblo had for decades been a stronghold for Democrats in southern Colorado, but Biden just barely won here. And in fact, Trump barely won the county in 2016. That's a big change. Another big change that might be on the horizon, look up at the metro area. That light red splotch is Douglas County. Douglas is really the last Republican bastion in the Denver metro area. Democrats are gaining ground here, though. The dark shaded counties show where there were landslide results. And there's a lot of dark shading, a lot of dark blue, a lot of dark red. So Colorado might be true blue, but it is a polarized true blue. All right, I want to play a quick game. We'll use the chat feature here. Just because we're locked down, we figured we will find a way to give away some CHI swag. The prize today is a coveted CHI vest, because nobody looks cooler than a policy analyst. So here's the game. I want you to place these ballot choices, 3 ballot issues in Joe Biden, in the order of the number of votes they received, and just use the letters. So if you think Gallagher repeal got the most, then nicotine tax, then family leave, then Biden, you would type in A, B, C, D. All in one message, please. And don't hit return in between, because otherwise we won't be able to figure out what order you're using. The first one with the correct answer wins. I'm going to show you 3 more maps, and then we'll show you the answers and reveal the winner. So let's get started with that Gallagher repeal map. Gallagher is part of that wonky, famous fiscal Gordian knot that people talk about when they talk about how hard it is for the legislature to budget. Basically, it keeps residential property taxes low. This hurts local governments and services like fire departments most of all. And firefighters played a starring role in the TV ads that favored repeal. So look at this map. The green is where counties, a majority of voters voted for the Gallagher, to repeal the Gallagher amendment. That includes El Paso County, basically the capital of Republican Colorado. It includes Weld County, another conservative county. Really, the Eastern Plains are the only big region that decided against repealing Gallagher. That's a pattern you're going to see in the next couple of maps too. Next, the nicotine tax. Everybody knows Coloradans don't like raising taxes on themselves, but they make an exception for sin taxes. A similar tobacco tax, though, failed just a couple of years ago in the face of a huge advertising campaign by tobacco companies. This time, though, is a much different story. Red counties like Douglas, Weld, Mesa, El Paso, they all voted for it. This is an important result for public health, because it applies special taxes to vaping products for the first time. Colorado teens have led the nation in their rates of vaping, nothing to be proud of, but the experience tells us that making vaping more expensive will lower use. Last map I want to show you, maybe the most interesting, at least to me, paid family leave. This was a policy that could not make it through the Democratic-controlled legislature in 2 attempts the past couple of years. It's just seen as too controversial, or too progressive, even for some elected Democrats to get behind it. But again, look at the map. The first thing that I see is it looks a lot like the Biden map, but a couple of big differences. El Paso and Weld County, again, voted for paid family leave. So that means there were people who voted for Cory Gardner, voted for Donald Trump, and voted for paid family leave. So here we go. My CHI colleagues, have we been monitoring for a winner? Let's see. I need to. All right, I think we'll get a winner to me in just a second. Contest is now closed, and I will reveal what the order was. These are numbers of people who voted for each ballot initiative. 2.1 million Coloradans voted in favor of the nicotine tax. 1.8 million voted for family leave, just a couple hundred more who voted for Joe Biden. And Gallagher repeal, which affects personal property taxes, is that was the last of our 4. And okay, I'm told we do have a winner, Evan Holiday. I'm gonna keep trying this. I'm gonna make it work. It's gonna be the new Zoom thing. All right. So jokes aside, contests aside, the takeaway from all of this for me is that ideas like paid family leave that seem really controversial inside the Capitol are actually a lot more popular across voters, among voters across the spectrum. An idea that seems too progressive for the legislature to out of left field, it might actually be embraced by a substantial number of Gardner Trump Republicans. So I would think this would give the progressive wing of the Democratic Party a lot of courage from these results. I might even look at the Gallagher Amendment and how that passed, how a fairly large majority of Colorado voters said, yeah, it's okay, get rid of this thing that keeps my property taxes low. And people who have been trying to change or repeal the Taxpayers' Bill of Rights might kind of look at this campaign as a template and get going on those efforts again. So that was the message the voters sent as interpreted by us at CHI. And here's who they sent to the Capitol. There are very few changes in party makeup since last year. In fact, really only one seat in total. Democrats picked up one seat in the state Senate in the suburbs of southeast suburbs of Denver. The parties each traded a seat in the House, so Democrats keep their 41-24 advantage. With majorities like this, Democratic leaders have some pretty wide latitude to get their agendas accomplished. And that's all that's standing in the way is money, and Allie's going to talk about that in just a couple of minutes. Here's your Senate leadership team. It's the same set of leaders from 2018-19, led by Leroy Garcia, Democrat of Pueblo. Majority leader is Steve Fenberg, and minority leader, Republican leader is Chris Holbert. The House, though, has an all-new leadership team with Alec Garnett of Denver taking over as Speaker of the House. Danae Escar is ascending from her seat on the Joint Budget Committee and to be the majority leader. She's the only woman among the 6 senior leaders. This despite Colorado electing more women to the legislature than almost every other state. And Hugh McKean is the new House Republican leader. This is going to be a big change because he's replacing Patrick Neville, who was much more of a firebrand. Neville would threaten recalls against Democrats, use delay tactics to push debates deep into the night on a pretty regular basis. McKean is seen as more of a traditional legislator, practical, compromising, fighting for his party's priorities while respecting the norms that are that exist in the legislature. And here is the Joint Budget Committee, the 6 people who have the unenviable task of balancing the budget through this recession. Democrats have a 4-2 majority, and it's a usually plum assignment to get on this committee because you control the money. But when money is tight or moving around really in really unpredictable ways, it can make you the bad guy. 2 people we'd like to spotlight. First, Senator Bob Rankin, a longtime JBC member. He almost lost his re-election campaign on the Western Slope. Almost, but he did win by just over 1%. It was one of the closest races in the state. He's back on the JBC and he'll be an experienced hand, we think, this budget cycle. He's been to this rodeo before. And then there's Leslie Herod, Democrat of Denver. She is new to the Joint Budget Committee, but definitely not new to the state budget. She is a former state budget analyst. Lately, she's been known for her efforts in behavioral health. She ran the Caring for Denver initiative a couple of years ago, and we think that she will be a go-to person for behavioral health issues and advocates on the JBC. Big news in that realm. Now, the legislature is scheduled to convene its 120-day session on January 13th. By law, they have to convene that day. But thanks to a Supreme Court ruling last year, the session doesn't have to be on 120 consecutive days. So there's talk of gaveling in quickly, saying the legislative equivalent of, hi, how you doing? Gaveling out and coming back in the spring once the coronavirus surge has passed and hopefully vaccines are in fairly wide circulation. Public health folks might call that a good idea. I worked for about a decade as a reporter covering the legislature. I know firsthand from many sick days why people call it the Capitol Petri dish. Rumors aren't the only thing that spreads quickly around that building. So that catches us up to where we are today. Allie's going to tell us what to look for now when the legislature convenes, whatever that is. So I'll turn it over to my colleague, Allie Morgan.
All right, thank you so much, Joe. Good morning, everyone. My name is Allie Morgan, and like Joe, I am one of the directors at CHI. I also wish that I could see all of you in person today, but on the plus side, I am not wearing uncomfortable shoes and it's snowing outside. So my token houseplant and I are really thrilled to be here with you virtually. So Joe covered the election results and the personalities who will really be driving policy decisions in Colorado next year. I'm going to talk now about the budget, including how the need for economic relief played out in the recently completed special session, and then provide an overview of some of the health policy issues to watch next year. So I want to start with a quick look at the special session. The pandemic, as all of you know, really decimated finances for families, businesses, and for the state. In light of that, the last group of legislators returned to the Capitol one more time for a quick special session that was really focused on economic relief, and that wrapped up just last Wednesday. There was quite a bit of bipartisan collaboration during that time, but those 3 days were not without partisan politics. The first day especially was marred by some debates around wearing masks and who should and shouldn't be allowed on the floor, and opinions on that fell largely, though not entirely, along party lines. So that might foreshadow some of the partisan dynamics that we expect to see for the upcoming session. Ultimately, 10 bills passed and were sent to Governor Polis for signature. Though COVID-19 really feels omnipresent, healthcare didn't feature explicitly very much during the course of that session. In addition to helping small businesses, however, legislators passed measures providing relief for food pantries and childcare facilities, housing supports, and expanded availability of broadband. So these are things that we think about as health adjacent issues that really have clear impacts still on our health and well-being. Legislators repeatedly stated during the 3 days that they knew what they were providing in terms of financial relief was not enough, but also they said that on its own, the state just doesn't have enough to give and that doing something is better than doing nothing. So that was kind of the message. It also might make it easier for them to delay the start of the session if they need to, as Joe pointed out. So each year at Hot Issues, Joe and I include a section on the budget, but I think what's notable about 2021 is that the budget may be the single biggest factor determining what policies can and can't pass. In other years, it might be more a question of political will, for example. So Governor Polis's budget request, which was released as usual at the beginning of November, is really what kickstarts the budgeting process for the fiscal year that's to come. And typically, the governor's request gives us a pretty clear picture of what we can expect the final budget that's written and adopted by legislators to look like. However, given the current level of uncertainty, I think that this budget request could be unusual and that it may end up looking fairly different from what's ultimately adopted in the spring. So there is a lot included in the budget request package, which you know if you have read one or helped put one together, as I know some people on our webinar today have. And at a high level, most agree that it may be a little bit ambitious. While the economic situation has been buoyed in a few ways in Colorado, certainly, we are still struggling through tremendous volatility and widespread unemployment in our state. Polis's budget includes $13.6 billion for the general fund, for example. That's an increase of $2.3 billion, or about 20% from the current fiscal year to his proposed budget for next fiscal year. That may seem surprising, though it's less of a change than it looks to be on paper because of some one-time budget moves that legislators had to make back in the spring. So through the proposal, Polis aims to do a few key things. first is support for recovery in 3 different spheres that he's calling out. The first one is related to the pandemic. The second is related to the economy. And the third is related to these historically large and destructive wildfires that, of course, we also suffered through as a state this year. Polis also says he wants to restore some funding that was lost through recent budget cuts, especially for K-12 and higher education. And he's saying that he wants to add to the state reserves. They're down just below 3% right now, and Polis is saying that he hopes to get them to 10% at the end of the next fiscal year. So that would be a really substantial increase. And he's allocating dollars for these things in the budget request. Some of those dollars were then allocated during the special session that just wrapped up. Here's a quick look at how the proposed general fund budget, which is the portion of our state budget that the legislature can control, breaks down. So the largest part, about a third, light blue, is taken up by K-12 education. Next, in the dark blue, I have no future as a TV news person, by the way. The dark blue on top is Medicaid and other programs run by the Department of Healthcare Policy and Financing. So that makes up about a quarter. And you can see that between K-12 education and our Medicaid department, that's about 60% of our general fund budget in the governor's proposed request. Human services and higher education are not insignificant portions either. You can see those across the graphic in the purple and the green over here. What does look really small on this general fund graphic is our Department of Public Health and Environment, or CDPHE, which is that tiny red sliver on the far left side. And that department tends to receive more federal funds. So it's clear that healthcare accounts for a large portion of our state budget, which is typical. What are some of the governor's top health priorities for next year? Well, according to his budget request, 2 of them are public option and prescription drug affordability efforts. I'm going to come back to both of those in a few minutes. In addition, despite the daunting economic situation we're in, Polis is asking for funding for certain health initiatives. For example, he is asking for more than $10 million to backfill losses in federal funding for Child Health Plan Plus, or the CHIP program. More than $7 million to improve IT resources for different behavioral health programs in our state. And $1 million to identify and address disparities among Medicaid enrollees through better use of data. Notably, in the governor's request, there is no across-the-board provider rate change. That can be seen as either bad news or good news, depending on if you were hoping to see a rate increase or more so fearing a rate cut. And while there's a new inpatient and residential substance use disorder treatment program being implemented under Medicaid, there are also cuts being proposed to different substance use programs in HCPF and also within the Office of Behavioral Health and Community Corrections. So it's almost a balanced budgeting approach that we're seeing from the governor's office, adding funds to some initiatives to account for taking them away in other programs and vice versa. This has concerned some advocates who say that there was not enough money for substance use programs in the state budget to begin with. And so we really shouldn't be thinking about it as kind of this zero-sum approach. We should get a bit more clarity soon on the budget situation through ongoing department budget briefings. Several of the health departments had their briefings this week, for example. And also the next quarterly revenue forecast is scheduled for December 18th, which is next Friday. So that will give us more detail than we have today, but it may be a bit of a wild ride for the next few months. I think the takeaway on this budget situation is that things could certainly be worse given our state's economic situation, but there is some concern that the governor's request might turn out to be a bit too rosy. And while there is funding planned for some new initiatives, there are also reductions planned for other programs that seem to somewhat balance it out. Okay, so on to our final section, which is about upcoming health policy. I'll preface this by saying that a lot of what I'm going to talk about may sound familiar because it was considered last session. So frequently I'll say this was proposed last session. And frankly, many of these policies would have probably passed already if it weren't for the pandemic. So as I jump into this, I'd love to ask you all to share in the chat, again, not the Q&A, but the chat, the health policy bill or topic that is the highest priority for you in 2021. I know we have a really diverse audience joining us today with varied perspectives and backgrounds. And so I'd really love to hear where all of you are focused going into next year. And hopefully I'll touch on some of them in the next 10 minutes or so. So I'm going to start by identifying 4 big health policy issues to watch. First is public option. Next is prescription drug pricing. Third is behavioral health. And then fourth is telehealth or telemedicine. So I'll go through these one at a time. Okay, so starting with public option, this morphed last session into what was known as the state option, but I'm going to continue to call it public option today. I think that's the term more of us are familiar with. What we know at this point is that it is going to be introduced because it was included in the governor's budget request. It is going to be really controversial, and no one is able to share any details yet about exactly what it's going to look like. To jog your memory from last year, a bill called for a state-designed plan to be offered by private insurance companies. And it said that that program would achieve savings in part through hospital rate setting for services that were provided to members of that plan. Hospitals and insurance companies were not fans of this approach, and the bill really fell apart after COVID paused the legislative session. And frankly, the optics of going after hospitals when they are hustling to respond to the pandemic, which they continue to do, those optics have just changed pretty drastically during that time. It sounds like the same legislative sponsors will likely carry the new public option bill next session, but the design will be different. Again, we just don't know what that design is yet. So how might it look this time around? It could end up being written as a true public option. So that would be a Medicaid buy-in program, for example, or allowing people to buy into some other state-administered program, probably under HCPF. It could continue to be a state-designed plan that's offered on the marketplace, but with different rules for participation for hospitals or insurance companies. It could and probably will propose something different in terms of funding and where it's going to achieve savings. So some other states, for example, have proposed using 1332 waivers to help reallocate some federal funds to support a public option program. I know we're all really interested to see how that ends up looking. Next is prescription drug affordability. The governor and Democratic leaders have made progress on many of their stated health goals in recent years, but I actually think this is notable as an area where they have not made much progress in the past couple of sessions. Legislators did pass a high-profile bill back in 2019 to cap the price of insulin, so I want to acknowledge that. I know that that was a big deal to a lot of people, but I think that broader attempts to increase transparency or save consumers money have really not gone anywhere in recent sessions. So for 2021, some recent transparency-focused bills may come back. We also know that a bill is coming to create a prescription drug affordability board. This was planned for last session, but was never introduced. So that new board would conduct affordability reviews and notably would have the authority to set upper payment limits for the most expensive prescription drugs in Colorado, which would be a pretty big deal. Advocates believe that this is one way to go beyond simply requiring more transparency to actually make prescription drugs more affordable for Coloradans. Next is behavioral health, which, as all of you know, is a very far-reaching topic. Even before the pandemic, more than 1 million Coloradans were already struggling with behavioral health conditions. We know in Colorado that the political will is there for continuing to tackle needs and gaps related to mental health and substance use. The question at this point, as I alluded to earlier, is, will we have the money? Many behavioral health programs have recently been delayed or cut. And while a group of bills did pass last session to create some important substance use related policy changes, they had almost all of their funding stripped out in order to get through. So that just limited what they were able to do. A lot of focus right now is on next steps for the Behavioral Health Task Force, which produced this report in September that outlines a series of recommendations. For example, the task force identified that the $1.4 billion our state spends on behavioral health is spread across 10 agencies and at least 75 different programs. A bill next session will direct the State Department of Human Services to come up with a proposal for a streamlined behavioral health administration, which would be a big change. We can also expect the return of a bill to require free annual mental health wellness exams for Coloradans. Last but not least is telehealth. As you know, this has been key for allowing continued access to healthcare during the pandemic, including behavioral healthcare. Utilization of telehealth services has been way up among some types of providers, though it sounds like almost all providers are still struggling to get their overall visit volumes to return to pre-pandemic levels. A bill did pass last spring that helped codify some of the temporary rules around telehealth utilization, allowing for new types of services to be delivered remotely and new types of providers to bill for virtual visits, like our federally qualified health centers. But a lot of questions remain about this. For example, there are questions from the state about both the necessity and the sustainability of the payment parity rule that we have on the books that requires equal reimbursement levels, whether a visit is provided in person or via telehealth. We know that HCPF is planning to bring legislation proposing some sort of change to this parity rule, and that would certainly draw a fair amount of attention. In addition, some providers have felt left out, frankly, of recent conversations about telehealth, and so we may see additional legislation asking to expand things like the use of teledentistry. So those are 4 areas that I chose to spotlight, but there is plenty more to expect in 2021. A few additional categories that I want to go through quickly, just to acknowledge a few other policies, are bills to support healthcare providers. We know the strain that our providers have been under and continue to be under this year, and we're expecting to see a handful of proposals aimed at helping them in different ways. For example, we're expecting a bill to add public health workers to the list of those who are protected from having their personal information posted online. We may see a bill to streamline and automate public health data reporting, which proponents say would both increase the quality of the data and lessen the burden on providers. We'll probably see discussions about supporting our direct care workforce, which is a group of people who was already stretched thin and generally underpaid even before the pandemic. And there likely will be legislation to protect confidentiality for doctors who choose to access peer assistance program services, which have helped some of them manage this incredible strain so far this year. There will also be a group of bills aimed at protecting consumers. This has been really important to the governor's office and others in leadership, according to their stated goals. So you can expect to see a bill to revisit an existing hospital discount program that consumer advocates feel is just not working as intended, and they hope to require better compliance and enforcement. We're expecting the return of a bill that's targeting healthcare sharing arrangements, often called healthcare sharing ministries, which have faced scrutiny from the Division of Insurance. In fact, I just saw another consumer advisory email from them in my inbox this morning. And then more work will probably be coming to tackle the issue of out-of-network billing. This would build on the work done through an important 2019 bill, but it's not clear yet, at least to me, what those out-of-network billing policy proposals might look like. We'll also see conversations around increasing access to covered services for consumers. So that includes a bill to expand the ability of people without documentation to access contraceptives through the Medicaid program, and potentially some discussions around ensuring more state-level protections for the different aspects of the Affordable Care Act, which is facing a Supreme Court challenge. But also, we'll see the return of a bill that would require upfront analysis of any legislation mandating new insurance benefits. So that could cause some groups to want to pump the brakes on those kinds of proposals until we figure out what's happening there and what future requirements look like. And finally, we know that health is such a broad subject, and each year it seems that our policy community is rightfully focusing on more of these community health or health adjacent issues. So in that vein, we expect a slate of housing bills, including more focus on rental assistance and inclusionary housing, and some efforts to protect Coloradans against different types of discrimination, like age discrimination, which proponents say is really important at a time when our unemployment is so high. And then I already mentioned some other bills and budget priorities that I think indicate a larger focus on addressing inequities and combating racism in Colorado going into next year. So this probably goes without saying, but just a disclaimer that this was by no means meant to be a comprehensive list of all the health policy we're expecting. There are plenty of proposals that are not on CHI's radar yet, and others we just don't have time to share with you today. So I'd encourage you to check out our upcoming legislative forecast report, which should be released sometime in January if you are interested and would like some more policy details. Because I wasn't able to cover so many things today, I'd also invite you again to put in the chat if there are other health related bills that you know about and that you're okay to speak about, just to share those both with us as we put together our legislative forecast report and also with other attendees who might be interested in knowing what's coming. So while you're doing that, this is a state policy preview, but we have to acknowledge all of the upcoming changes and the continued uncertainty at the federal level. A few big questions that I just want to note before we wrap up here. How much additional COVID relief will Congress allocate for states and businesses in the coming months? Our legislators and others are really waiting on this answer to figure out what type of support they can provide. Next, what exactly will the Biden health plan look like? And what can President-elect Biden realistically get done given the state of Congress? Georgia is certainly on our minds over the next few weeks. And then what will happen with the Supreme Court challenge I mentioned earlier to the decade-old Affordable Care Act? A ruling is expected by June, and CHI will have a new resource available soon to explain what's at stake in Colorado if that's something you're interested in. So for me, the takeaway from the policy section is that earlier questions about COVID policy fatigue and whether it would leave any appetite for other policy discussions, those questions just appear to be unfounded because there is clearly a lot coming, and particularly a lot coming back for next year. So that's our legislative preview with a look at Colorado's true blue status, the economic uncertainty that we're facing as a state, and the health policies, many of them bipartisan, that we expect to see. In closing, Joe talked earlier about our state's extraordinary voter turnout, and Michelle has also called for a new moonshot. These are really trying times, but they also offer opportunity, which I see as a chance for us to show up. And we are doing that in our state. We know that those at the federal level are increasingly looking to states for leadership, and we know that other states are looking to Colorado. So the whole CHI team is really glad to be doing this work with you. And also, I think we can all agree that a new year cannot come soon enough. So thank you very much for listening. And with that, I think we've got just about 8 minutes or so to take a few questions from the Q&A.
And I'll get started on that. Allie, we'll let you catch your breath while I have a couple of questions from, or 5 or so questions here. First, a quick one that I'll take from Ira Gorman. How do you explain Congressional District 3? That's where longtime Republican Congressman Scott Tipton was ousted in a primary by Lauren Boebert, a real outsider and very much a pro-gun person and seen as pretty far to the right. And she went ahead and beat Diane Mitch Bush. Asking me to go back to my previous career as a political reporter rather than a health policy analyst. I'll do that because I reported on the Western Slope for the Durango Herald. I know that's a huge district geographically, one of the biggest in the country. And I also know that there isn't a whole lot of media out there. That often myself and a few other reporters in, say, Steamboat Springs or Grand Junction, we're really the only ones covering the race, and even then, we didn't get to spend a lot more time on it. Newsrooms have shrunk, and it's and local press tries their best just to cover their local city councils and whatnot. So it's kind of hard for these second-tier races to break through, and you couple that with Western Slope following this kind of rural urban suburban split in among Republicans and Democrats, and I see that probably has a lot to do with the result there. I'll take another question too from John Kelty, and I will ask Ali to help me with it too. He asks about COVID long haulers, and these are people who have long-running symptoms of COVID that are starting to resemble chronic fatigue syndrome. So the legislature, what can the legislature do? What will they do to help Coloradans with these post-viral diseases? Ali might be able to tell us if she's heard of anything, any specific policy. I know that the legislature could require insurance companies to cover more services for this, but they're also getting really wary of having too many mandates on insurers. And there's really an effort, I guess, to take a break on extending mandates on what insurers must cover. Ali, do you have any insight into that?
Yeah, Joe, I was going to say something similar. I have not heard anything about that. And, I mentioned earlier that there really wasn't a lot of talk about COVID and healthcare specifically during the special session. So I'm not sure what that would look like. But the insurance mandates piece is also where my mind went. Who knows, maybe legislators and others would be more open to increasing mandates for things that are directly related to COVID than just in general. But I have not heard anything else about that. It's a really good question.
Great. Thanks. A couple of questions from Phyllis Albrecht, and I'll take the first and I'll punt the second over to Ali. First, incoming president has public option and prescription drugs on his agenda. Why would Colorado do legislation on this if the feds are going to do it anyway? My answer is that's a huge presupposition that Congress will do anything. At the very best that President Biden can hope for is a Congress with 50 Democrats. So it's been Governor Polis's thinking that, and Democrats in the legislature too, we're kind of on our own, and I don't see how the federal election results will change that calculation all that much, although they will have a more cooperative Department of Health and Human Services in Washington to work with. Next question for Ali. The past year's budget estimates were off and the governor had extra money to spend in the special session. Is that going to become a regular occurrence?
Oh, good question. I have no idea how to know if that's going to happen again, but I think that legislators on the Joint Budget Committee and others in the governor's office would tell you that it was so difficult for them to know what they were going to be working with in terms of their budget because COVID came in, as you probably remember, right in the middle of the legislative session. They paused and then were gone for over 2 months. And I think part of what has led to some of the budgeting challenges, up and downs, overcutting even, is that they were trying to predict, economic outcomes that just were unprecedented. And so nobody knew what was going to happen with things like tax revenue in our state. It sounds like over the past few months, the tax revenue hits actually haven't been as bad as they were expecting. In addition, there was a lot of budgeting done to prepare for this huge anticipated surge in Medicaid enrollment at HCPF. And my understanding is that that just hasn't materialized, at least at the level that many policymakers were expecting. And so that's actually created a little more of that budget flexibility, which helped fund some of those priorities in the special session. So I think it just really depends on how much either COVID continues to cause this uncertainty in our budget or whether we're able to get a little more economic stability. But there were a lot of one-time maneuvers pulled last year and just a lot of guessing on a pretty short timeline about what things were going to look like. So I don't know if it will be similar next year or if it might be a little bit more settled. Good question.
All right. A question that we can answer in writing here about the name of a bill regarding peer assistance services. Ali and I will get to that when we're off stage. A couple of questions on telehealth. What's the biggest need? Can we say anything more about the proposed changes to pay parity for telehealth?
Yeah, I think that is going to be one of the most important and watched issues of the session in terms of health policy. I don't know what that parity proposal is going to look like. I know that HCPF and others have been really talking to consumers, looking a lot at utilization data, looking at budgets, and trying to figure out how all of that might look going forward. I don't know how many changes we'll see before, next summer or even the summer after. But the reimbursement parity question really will continue to be the biggest one. We also just know that the use of telehealth is evolving so much. You have a lot of providers who weren't doing any healthcare visits, at all through telehealth before the pandemic. And so I think it feels difficult for some at the state to create these future policy rules before they know exactly what those utilization levels are going to look like in whatever the new normal is where we find ourselves, because we just haven't yet gotten far enough into or out of COVID to know how those are going to settle and which kinds of providers are going to be doing a lot of telehealth or only using it as a last resort. I will say that I know those at the department are wondering about efficiency opportunities. Are there cost savings available for different kinds of providers through doing more telehealth visits? And I think that that's an ongoing conversation. So I'm not sure exactly what that's going to look like, but certainly is something that we'll be watching. We've been doing a lot of work on telehealth recently.
All right. Well, thanks a lot, Allie. I think we are about to get the hook here. We still have some great questions in the Q&A panel, and we'll do our best to provide some written answers to those in the next couple of minutes. One more quick note that I forgot to mention in the beginning: we are recording this, and check our website next week. We will have the recordings posted then. So, Allie, any wrap up?
No, just thanks all for your great engagement and questions, and look forward to working with you next year. So I think at this point, we can go ahead and turn it over to our colleague, Christy Ariano, for the panel discussion. Thanks, everyone.